In my daily practice, I get lots of misconceptions, lots of questions around heart attacks. And I want to dispel these misconceptions. I want to tell you what heart attacks are, what are the myths, and what are the facts today. A very important myth which is pervaded universally, that women do not get heart attacks. Absolutely rubbish. Women get heart attacks equal to men, and at times worse than it happens to men. So all women need to know that they have to take care of their health and their heart health. Another common major myth in our society. I'm slim. How can I have a heart attack? People need to understand slim does not mean that your cholesterol is less. It does not mean your heart is healthy. It does not mean you're fit. It is the fat composition in your body, the cholesterol levels in your blood, and your genetic risk factors and your addictions that is going to dictate whether you're going to have a healthy heart or an unhealthy heart. So please do not think that if you're thin, you cannot have a heart attack. The commonest misconception around heart attacks has been that it happens in older men or older women. It used to be true a few decades back, but not anymore. With changing lifestyles, younger and younger people are getting exposed to heart attacks. And India is the biggest example where the largest number of heart attacks happens in younger patients. Is chest pain the only warning that you're getting a heart attack? Yes and no. Yes, because it is the commonest symptom of heart attack. No, because there are many people who will experience a heart attack by not experiencing chest pain. Some of them just feel unwell, drain of all energy, they feel breathless, and diabetics may feel nothing, which is called a silent heart attack. If you like this video, don't forget to like and subscribe. You must be watching movies, and most movies dramatize heart attacks. But in real life, does heart attack occur as dramatic? Not really, not always. Very few heart attacks can be dramatic, where you can collapse and you may lose life, or it can be fatal. Most heart attacks come with excruciating chest pain associated with sweating, feeling breathless, and lack of energy. And some of them can come only with breathlessness, or some of them can have no symptoms at all. So it's important to know that there is a spectrum of symptoms that a person with heart attack can experience. Do not always think of the worst. Once someone has a heart attack, the patient is shell-shocked, which is understandable, but even the relatives get paralyzed and they feel that they can't do anything and they panic. Take a deep breath. There are some things a bystander can do, or even the patient can do himself to be alone. Always keep aspirin or Disprin handy at home. Chew it if you can't swallow it. And that can help dissolve the clot to some extent. Of course, do not forget to call for help. And another important measure, which I recommend the entire population should follow, and our government agencies and hospitals should work towards this, to teach basic cardiopulmonary resuscitation to each and every citizen. That really saves life. And the more advanced features which many Western countries have, that around an area, they keep these defibrillators or shock giving machines, which can be easily used if you see a person collapsed in front of you. So I think that there is a lot the population can do as a first aid measure before the heart attack patient reaches the hospital. A small tip: whenever you visit a doctor, feel free to ask questions regarding your health. After all, it's your health. We need to know more about it. So my recommendation to patients is read a little bit about your health. Read what you're suffering from. Don't read everything in Google. Select good places to read and ask questions to your doctor. Have a conversation with your doctor. Let it not be one-sided that the doctor keeps telling you something and you keep nodding because you don't know what's wrong with you.